If you've got chronic knee pain and are looking for simple exercises to make that knee pain go away as a long-term strategy, then I'm going to explain to you why I think that cycling or riding a bicycle fits the bill perfectly. I'm Dr. Brad Homan. I'm a board-certified orthopedic surgeon. I have been in practice for over 20 years, and I'm an expert on knee pain. And so in other videos, we've talked about etiologies for different kinds of pain, like arthritis and meniscus tears, patellofemoral syndrome, or kneecap pain. There are a lot of different causes of potential knee pain, but I see a lot of patients that have these conditions that cause chronic pain, and a lot of them are doing the exact same thing wrong. And the most important thing that they're not doing is they're not exercising. So it's important to consider that the muscles around the joints support that joint. And I tell patients specifically that the thigh muscles are the shock absorbers for the knees. And so if you've got strong muscles that wrap around your knee, then regular impact activity that you perform day to day is going to be lessened because the muscles are going to offload some of that force. And so it's going to basically take some of that stress and pressure off of the knee joint structures themselves. And so a lot of patients will tell me that their form of exercise is walking all day or long distance walking. And I tell every patient that I think that that's great. Walking is a great form of exercise. It does burn calories. But if you're having knee problems, long distance walking can actually be a little bit aggravating because each one of those little steps is a small impact. And over time, those impacts can add up and really aggravate the knee. The second thing that I talk about walking is not a great form of exercise is that it's not really strengthening the thighs. So walking, again, is good cardio, you're burning calories, but you're not really building up your muscles very much. And it's important long term to keep those muscles strong to support the joint. And so cycling fits the bill perfectly because it is a non-impact exercise and it does strengthen not just your thighs, but your glutes and your core as well. So keeping those muscles strong to support the knee joint is going to be your best long-term strategy. So it is important to consider how you start this exercise program if you've got painful knees, because if you don't do it right, you may actually aggravate your knee pain a little bit. So a couple strategies would be: number one, make sure you start out with a very low resistance and you don't have to ride forever. You want to keep your riding times low until your knees sort of acclimate, and when you don't have any discomfort or when your muscles start to get stronger, that's when you increase either the resistance that you get when you're riding your bike or exercise bike, or the duration of time. And so the stronger your legs get, the more resistance you can add and the more endurance you'll have, and so the longer you can ride as well. So how long you go depends on you, but the key is make sure that you're starting very light and very easy, and then you build on that as you get stronger. The second thing that's important is making sure that when you're riding that your knee isn't bending too much, especially if a lot of your pain is coming from your kneecap or the front of your knee. If you're bending your knee a lot during these exercise cycles, then you're going to be aggravating that kneecap. And so you want to have the seat adjusted in such a way that you're not really bending your knee more than like 35 degrees or so. So those are the two main points when someone's beginning a bicycle riding strategy to start, so that you can make sure that you don't aggravate your knee in any way. And you will notice that as your muscles get stronger, your knees will start to feel better. Is cycling great for knee pain? The answer is absolutely yes, but you need to make sure that you do it in a proper way so that you're not actually making your knee pain worse. So if you thought this video was helpful, please like and subscribe, hit notifications for future videos. I have other videos which go into etiologies of knee pain in a lot more detail, so check those out on my channel. And as usual, my message to you is to keep your knees strong and they will take care of you.